Hello, I'm Dr. Michelle McGowan.
I'm Dr. Tim Henney.
And today we are actually going to take a little different swing. This is our first day back seeing patients in the office since our kids had spring break. And we kind of want to talk a little bit about the things that you should not wait to go see the doctor.
Make sure you get in quick before something is really bad.
Yeah, so I mean, there's a lot of things that you probably should get in for if, as far as foot and ankle problems and infections and fractures. However, today we're going to talk a little bit about wounds and infections. And for me, this is like a near and dear one because I was at the wound care center today seeing patients who can't wait weeks and weeks to be seen.
Yeah, because if they're not being seen, they get infected, they're going to end up in the hospital. So.
Right. And, I can tell you one of my biggest problems sometimes in that setting is we have patients that have no sensation, so they don't think anything's wrong even when there's pus pouring out of their foot and it's all red hot and swollen.
Exactly.
So
10 of those people today, unfortunately, none of them were red hot and swollen pussy.
So we do see a large portion of diabetics who, and usually it's our type 2 diabetics. I mean, we see a couple type 1 diabetics, but usually our type 2 diabetics who build neuropathy, they have a lot of other comorbidities, and they'll come into the office with a foot that's red hot swollen, and they need care, whether it's we need to debride the wound, we need a incision and drainage, we call it IND, the wound.
Antibiotic pills, antibiotic cream.
Antibiotics by mouth.
Debriding cream, something.
Setting them up with infectious disease, for antibiotics if we're still trying to keep them out of the hospital setting.
Setting home health up if possible. Come take a peek at it.
Right. I actually got in an argument today with a patient who they were told to go last week to the hospital and they didn't. And now this week it's worse and they still don't want to go. And they need most likely some debridement and more higher level care that I'll have to provide on the hospital side, which stinks because I don't want to go in the hospital. But
I'd say in general, if you are diabetic or not, and you have something open and bleeding, and it's red hot and swollen, and if you don't know what that looks like, take off your other sock and shoe and look. If it looks a lot different than the other one, make sure you go somewhere fast, whether it's a podiatrist, orthopedic, your primary care doctor, urgent care hospital. But if it's infected bad, something needs to be done.
Well, the whole
quick.
point is we're trying not to go to the urgent care and ER. If you
I
can go telehealth visit with a doctor to see if you need to go to the hospital, just don't ignore it. I think that's the big piece of that we're trying to stop.
Take a picture, email it, text, whatever you got to do to whoever around you.
Right. But sometimes you got to go into the doctor's office for something to be done. And that's what this time in the states of emergency everywhere, there's certain doctors that are still there for you. And we happen to be two of them. What else? I can put examples if the internet's like me.
If the internet works today.
But
we'll put some pictures of stuff that's bad that you should call. Yeah,
and I'll put it underneath in a little blog with pictures, what you should do, what you should be concerned about. Even people with like an infected ingrown nail, there's no reason to suffer. What do you think? Suffer with that?
You can do a televisit to see if his wart's coming in, but
sometimes we can wait for an antibiotic. And then when stuff passes over in a couple weeks,
but in all honesty, you kind of need to see it. Now, we could see it over the phone and tell you, well, yeah, you should probably come in and get it fixed, or no, it can wait a week. But, I mean, there's a way to do a happy medium, but more than likely, you're going to need something done eventually anyway.
Right. So, we'll have a little post about that, but if it's red, hot, swollen, if you have any type of discharge, yellow, green, even if it's bloody looking from the foot, that's the only type of discharge we deal with.
Get on the computer, figure out something from somebody's fast.
Yeah, and we'll try and update you on different topics, but this one, especially today, after seeing a lot of wound patients, I want those patients to know you cannot wait. If there's something that looks, smells, any of the above, you got to get in, you got to see someone so you can prevent having to go to the hospital.
And if you have a cell phone, it's really easy to do.
Take a picture, we can do a telehealth visit, or wherever you live, there's probably somebody who can do that as well for you. All right, well, I think that's all I have.
Dr. Tim Henney.
I'm Dr. Michelle McGowan, and hopefully these are helpful. We don't know.
Wash your hands.
Wash your hands. Bye.
Bye.